On the idea of possibly screening junior high school students for depression within school systems, what is your initial feeling about that? Because people are divided on this. It's a controversial topic. Some people hate it, but some people say it's a great idea. Where do you land on that?
Man, I mean, it's almost like shocking for me to hear that maybe some people would view this as controversial because I almost feel like I'm so on one extreme of, yeah, why wouldn't we screen? Because these high school kids, middle-aged kids do achieve suicide. They do engage in self-cutting. Like I would if someone disagrees with that, I would say give me one reason, in the face of a potential death why we shouldn't at least bring this up.
So, one potential reason is that there's a concern that children in the United States are being over medicated.
Hmm.
There's been a sharp increase in the diagnoses of ADHD, depression, and all other types of psychiatric issues within the pediatric population. And I don't think, especially after going through the COVID pandemic, I don't think we can deny that certain industries, I'm talking about the pharmaceutical
Right.
industry, of course, they have a financial incentive to place people on medication. And especially here in the United States, I feel like patients are especially vulnerable to potentially some of the greed of the pharmaceutical industries because after all, we're only one of two nations worldwide where pharmaceutical companies can advertise directly to the consumers.
Hmm.
Like that's ridiculous. And we know that pharmaceutical companies are they fund a lot of money to lobbying groups, and they have a lot of power even within our media, right? A lot of their revenue, the media ad revenue, is being funded by the pharmaceutical industry. So I don't think we can ignore or even deny the fact that that is an extremely powerful organization,
Hmm.
and their incentive 100% is, I would argue, is never the well-being of somebody, but is their bottom line profit.
Yeah, sadly, I mean, I don't disagree with you there, right? But I think I mean, yes, more screening, more people who would be diagnosed with depression, of course, could potentially be started on SSR, or well, I shouldn't necessarily say SSRI therapy, but it would probably be most likely that, right? Or just we'll call it any antidepressants. I don't disagree with you there, but the when someone is screened for something, our first line treatment should not be medicine, right? It really should be, especially for like depression and self harm, is getting that person to engage in some kind of therapy, right? But I also think like I get really frustrated with the rigid system of therapy. Why does it always have to be something in a sense kind of boring? I have encountered some child programs that actually had like equestrian therapy, recreation therapy, art therapy, music therapy, like these kind of creative solutions
Where
to.
was this?
This is way out
Equer-
in
Horses?
yeah, in Oregon. Um, didn't end up matching there, but
Dang, sounds fancy as hell.
look, there are so I mean I agree with you. More patients screened hypothetically could lead to more patients on drugs, and yes, there is a financial motive. A lot of these medicines used in the pediatric population, scarily enough, might help with depression sometimes, but also one of the risk factors, the black box warnings on these medicines, is increased suicidal thoughts. So it's like, what are we doing here?
That's scary, right?
Right? It's extremely scary.
That's scary.
It's why would we help someone or try to help someone with their depression, but hypothetically maybe increase or worsen their suicidal thoughts at the same time? Now, bringing up a different industry that would argue is definitely evil as well in some regard. I think I would theorize that the increase in the mental health damage of this patient population is social media. So I think social media should actually be the one paying for screening, arguably maybe even paying for the treatment, getting these patients involved with professional mental health workers like you and me, and of course therapists and those other creative solutions. Because I would argue they're a big part of the problem here. The comparison that a lot of patients feel when they log onto Instagram or TikTok or these other things, or they always how the lack of communication skills because they're so addicted to these social media entities. That's my kind of big thing. And that was really what I was alluding to maybe earlier. Like, I think one of the best ways to screen these patients, ages 12 to 18, the best is always not necessarily having someone like me and you talk to them first. Maybe it's that when they're scrolling through Instagram, oh shit, to scroll further, I have to answer these questions about depression.
Would that ever make sense economically? I feel like if somebody sees that, it's gonna just increase their chance that they're gonna click out of whatever they're looking at.
Hmm.
I feel like there's a fundamental conflict with, I mean, because social media is inherently designed to be addictive, right? To capture your attention and to hold your attention.
Right.
So if I had to answer if I'm feeling depressed today to scroll to that next video, click, I'm
Right.
off. I'm moving on to that next platform that won't ask me that question. So it would be incredible if that kind of modality could be implemented across maybe all platforms. But that is a discussion much bigger than what you and I are capable of, right? These are,
Maybe.
well, I guess not the discussion itself, but the potential solutions, right? It's a political one. There's a lot of money involved, and Google, Facebook, Instagram. These companies are, I mean, they've got a lot of money,
Right.
and in this country, money is what makes things happen. So I wonder if that is a potential change that is even feasible. And at the same time, I strongly believe that these modalities, Facebook, social media, they're here to stay. They're not going
Right.
anywhere, right? So these issues with comparison, some of the anxiety, depression associated with social media use, these are problems that are going to persist, right?
Mhm.
Not just for the generation of adolescents today, but for the generation that's even unborn that are going to be coming into this world,
Mhm.
right? Potentially, they may be facing it at an even harsher degree. So when we're screening for patients with depression at such a young age, one of the concerns that I immediately have is, what is the goal? Is the goal to put somebody on antidepressants? If it is that the best possible way to help these adolescents dealing with some of those dysphoric feelings? Because I strongly believe that you need to prepare somebody for the road ahead. I think in today's culture, we're in this mindset that any sort of depression, any sort of dysphoric feeling is a negative and must be dealt with at all cost. But I don't think all depression needs to be treated. Only if it gets to a certain point and is starting to affect your quality of life, right? If it's having a tangible effect on your quality of life, yes, it should be treated with medication. But
Mhm.
at the same time, depression also is a normal part of life. It's a normal part of growing up,
Mhm.
right? There's always been, people teasing each other when you're kids, right? But through those experiences, you start to build resiliency. Through those experiences, you start to build empathy for the struggles of other people. So I think to a certain degree, those experiences are kind of necessary. And that's why I'm always hesitant, especially when the first step is just medication. And I think you touched on it a little bit, but I wouldn't mind these screenings. Actually, I would think it's a great idea if what we're promoting is CBT or other therapy-based modalities where we can teach individuals coping mechanisms. I
Mhm.
think for a patient that's 12 to 18 years old, rather than giving them a medication, teaching them coping mechanisms that they can utilize
Mhm.
even when they're not on medication is the best thing that we can do for them. Because what do we know about antidepressants? It's only effective as long as you're taking them versus CBT, even things like meditation, yoga, mindfulness. These are skills that you can obtain and they carry on with you for a lifetime. You can utilize them anytime that you want.
Right, right. Yeah, I mean, I think great points. I would, in some regard, try to defend the United States Preventative Task Force, right? Because, I would guarantee further in that, because they have all these preventative task force recommendations, right? And guidelines. And, you and I both know, and even if you're a therapist out there, like, ideally, we don't want to start with a medicine first. Ideally, we do want to try one of these other modalities. Um, I think sometimes us physicians, prescribers, feel compelled to do something. And, me and you, I wish we actually had more time to spend with patients. I wish that we had more time to provide psychotherapy. The nature of our skill set and our knowledge base with our understanding of medicines, that it seems like a lot of the time when patients end up on our um, footsteps, a lot of times they really, in a sense, are arguing, begging for some treatment. And at least that's a lot of the parents I've interacted with. They're scared. They're scared that their kid could be that next kid that ends up on that, really horrible funeral, right? So that's why I think I still am as pro screening as you can get, because I think it's important to get the input of the parents, of the kids, and also, but reaching that patient directly, because there are of course situations where maybe the parent, the teacher could have noticed an abrupt change, but there are definitely other situations too where someone did act really impulsive, or maybe they were able to put on kind of a good game face in a sense. You hear about those like high school quarterbacks, right, who were popular and then they still end up committing suicide. All of these things happen. Mental illness is not specific necessarily to the, high school reject or anything like that. You know, Isolation, of course, factors in here, but I think we do need to kind of collect as much data points as we can.